Hi guys, this video is for nursing students who have either graduated or are about to graduate and are thinking about getting that first job as a qualified nurse. So before you start applying for jobs, I would recommend that when you go for your clinical placements, make yourself memorable in the best way possible. So, what I mean is when you turn up for your clinical placement, introduce yourself. I know it's daunting when you arrive on a unit and people look busy. It looks like nobody wants to talk to you. Often people are just thinking about, um, I need to get report and start my shift. Some people are more cognizant of the fact that you're a nursing student, you might be a little bit anxious, and they'll come up and talk to you first before you talk to them. But if you are brave, smile, approach people, introduce yourself so that they get used to seeing you there and you become a familiar face to them, not just the student who turns up and talks to nobody. If you talk to people and are friendly, you become memorable. And when it comes to getting a nursing job, knowledge and skills um, are important, but what I see more is likability is important because what nurses want to know is, can we work together as a team with this person? Knowledge and skills can be taught. When you first qualify as a nursing student, that is when you actually start to learn. Much of what you've learned as a student is useful, but the real learning starts when you're the person in the driving seat, when you're the person with that nursing license and that responsibility and that accountability, which you didn't have as a nursing student. So make yourself likable, talk to people, smile, and if you can, crack jokes, just so that people remember you. If you're not good at cracking jokes, that's okay too. But just be, I guess, try to be brave and sociable because people notice things like that. And when the manager approaches the nurses and says, hey, that nursing student, we're about to start recruiting for our graduate program. What do you think of so and so? Do you think he or she would be a good addition to our team? If you've been someone that talks to the nurses, not just the person who's working with you, they'll remember you and they'll say, yeah, she's really good. She's really, really good. If something's happening, it looks like a patient needs help. If you step in and help, people remember that sort of thing. So I would start by just how you present yourself when you go for your clinical placement. The next thing I would say is if you are able to get a job as a PCT while you're doing your nurse training, get a job as a PCT, maybe as a PRN PCT or a part time PCT. Many nursing managers and directors actually like employing nursing students as PCTs because they typically, when they're looking after patients, they are able to identify problems and escalate them because they've learned about them in nursing school. So if you approach a nursing manager or director and say, hey, I'm a nursing student at this college and I'm looking for a job as a PCT while I study, would you be able to work with me? If I apply here, would you be able to work with me around my nursing schedule? Many of them will, because for some reason, some places have a really high turnover of PCTs. So managers, directors, they're always looking to recruit PCTs, especially people who are nursing students. So be brave. Again, you have to be brave. You have to, go against everything that your mind is telling you not to do because you're probably telling yourself, well, would they even give me the time of day? They will if you approach them in the right way. So, think about how do I approach someone in a way that makes them pay attention to me without being too overbearing. So, again, introducing yourself, smiling, um, just having a sort of approachable manner is very helpful. Now, if you're not able to get a job as a PCT and you've got to that point where now you've finished your nursing training and you're looking for a job, go to those career fairs and start talking to people, networking there. If you're not able to network within a hospital as a nursing student during your clinicals, or as a PCT while you're still in your nursing training period, go to careers fairs and listen to what they're saying. What kind of jobs are they offering? Do they have a graduate program? Um, and see if that's something that you want to apply for. Graduate programs, residency programs, many of those are really, really good if you're able to get onto one, because you're going to get additional classes and skills training while you're still precepting. So these will help prepare you for working independently as a nurse. The other thing that you could do is, if you are working or doing your clinicals, talk to the nurses on the unit and say, hey, I'm really interested in working in this type of department when I finish. Do you know anyone? Do you have any friends who work there? Would you be able to recommend me to that person, so they can speak to their manager on my behalf to see if I could come and do some shadowing shifts, just so I can get some experience there. I actually recently did that for a PCT. She wants to work in a NICU, and I don't work in a NICU. I work in an adult ICU, but I know a colleague from my other job as an educator who is a NICU educator. So I said to her, hey, I know someone who's wanting to work in NICU. She's a nursing student. She's about to finish. I work with her as a PCT, and I really recommend her because she's such a wonderful team player. Would you be able to pass on her resume to the managers on one of the NICUs that you are an educator at? And she said, absolutely. Give her my email address and ask her to send me her resume. So I went back to the PCT and I said, I want you to revise your resume so that it demonstrates transferable skills. So again, this is something important. You're going to be applying for your first nursing job. So nobody expects you to have all the skills at this point. You're a novice, you're a beginner, you've been a student. So nobody's expecting that you're going to know everything, but they're going to expect that you at least have some transferable skills from your clinical placements and from your job as a PCT. So I asked her to revise her resume, to highlight her clinicals that she did, where she did them, how many hours she did there, what kind of patients she took care of, and also to highlight her experience as a PCT. So I said to her, you need to highlight your team working experience, how you contribute to the team as a PCT. You know what your responsibilities are. If you do vitals and you know that there's a vital that's out of range, you are notifying the nurse in charge of that patient in a timely manner, and you're documenting your vitals in a timely manner. You're responding to patients when they call. You're offering the nurses help. So, that's demonstrating that you're a team player. You're also demonstrating good communication skills when you relay information to the nurses. And I told her, look at the job description and then look at what you do on your clinicals and what you do in your job as a PCT, and then look at how you can demonstrate those roles and responsibilities in the job description with the things that you've done in your clinicals and in your job as a PCT. So she was able to revise her resume. I helped her look through it once she was done revising it, gave her some tips on how to make it really shine. And then she passed it on to this educator, who then passed it on to a manager. And this manager already knows who she is. So when those jobs open up for the residency in the NICU, she has a very good chance of getting a job in the NICU. She wasn't able to get a clinical placement in a NICU at any point, because I don't know how universities allocate students to their clinicals. But unfortunately for her, she was never given the opportunity, even though she wanted it so badly. But that doesn't rule her out from getting a job in a NICU. because her job is to demonstrate transferable skills. So now I'm going to keep using her as an example. Now that she's got that foot in the door in terms of somebody who is a hiring manager in a NICU has her resume in hand, and they also have a recommendation from someone that they trust, she now needs to prove that she is as good as the recommendation. So she needs to prepare for her interview. So preparing for your interview is very important because, again, this is where you are demonstrating that you are a person that people would like to work with. It's very, very important to come across likable. So again, it's about how you interact with people, how you introduce yourself to people, how you carry yourself. How do you carry yourself around people? Do they look at you and think, yeah, I like being around this person? Or do they look at you and think, wow, she's irritating. She's really irritating. I don't think I could stand to be around her. So all those things matter. And then, of course, your skills and your knowledge. So you'll find that interviews these days are mainly about assessing your attitude and your character to work. Because if you've been able to complete a nursing degree, chances are you have a level of intelligence where you are capable of learning knowledge and skills on the job. But what they want to know, what they can't tell from your nursing degree, from that diploma or that certificate, is what kind of person are you? Are you someone that can come in and join a team and fit in and not be disruptive? Are you someone that can contribute and get the job done without causing disruption and being a distraction? So when they ask you those attitude type questions and those character type questions, like tell me about a time when you made a mistake, how did you deal with it? Or tell me about yourself. They usually, will start with that. Tell me about yourself. That's not necessarily saying, tell me about your dogs and how many pets you have or your favorite food or whatever. You can go into your career so far. So, yes, you are a new nursing student. Maybe you went straight to nursing school from high school and now you're looking for your first nursing job, or maybe this is your second career. So, you're going into that journey of where you started. As soon after I finished high school, I went straight to nursing school because I was very sure that's what I wanted to do. I wanted to be a nurse. So I went straight into nursing school. While I was in nursing school, I had a part time job as this, and I used these skills in that job to do this and that and that. And I was able to use those skills as transferable skills in my nursing training on clinicals. I found that the experience that I had working at Chick-fil-A, interacting with customers, gave me the confidence to interact with patients when I was doing my clinicals, that sort of thing. That's what you're talking about. And if they do mention and things like, oh, do you have pets? Then you can go into that. But you don't go into your pets or your best friends or your holidays. When they ask about, tell me about yourself, they're really asking about you as a professional, your education, your knowledge, your skills. What are you bringing to the table as a nurse that's coming to join their team? So your interview is your opportunity to convince them that you can work with them or they can work with you, that you would fit in and you would be a good addition to the team. So we've talked about the resume, we've talked about your knowledge and skills, we've talked about networking, and we've talked about the actual interview process. So those are the things that I recommend that you do in preparation for getting that first nursing job. It can be daunting, especially when you're thinking, well, all these jobs want someone with experience. They know you don't have experience if you're applying for your first nursing job. They basically just want you to show that, first of all, you are a team player, and secondly, you want to work, that you want the job. And that's another thing that you really have to show in your interview. You can't go in there and be nonchalant. You have to go in there and show some kind of passion and say, I've really been interested in working in NICU since I was a little girl. My little sister was born prematurely. I remember visiting her in the hospital with my parents and seeing the incubators and seeing the UV lights or whatever it was. That might be the experience that you had that made you think, I want to work in the NICU. Or you had an interaction with a nurse who worked in the NICU, or whatever it was that made you want to work there. Show that personal side of what inspired you to want to work in that department. And you could also help yourself by talking about any research you've done about the unit. So let's say you've been recommended by someone to them. You can say, oh, so and so who I know works on the unit speaks very highly of how this team works together collaboratively. I really like that the nurses are able to do this or that, or I love that the nurses are given opportunities to upskill and train and they're able to do this, because that's something that I really want to do as well once I've got a bit of experience. So researching the unit that you want to work in and showing that you have a genuine interest will work in your favor, you know, because you're saying to them, I actually really want to work in this unit, not just in NICU, but in this specific unit. So if you have any questions or you need help with getting that first job, drop a comment below and I'll keep an eye on your comments and respond and help out in any way that I can. Just remember that if you really, really want it, you can get the job that you want. You can get that dream first nursing job. It is very possible. Thanks for watching. Don't forget to like, comment, and subscribe.